What's going on, everybody? Welcome to The Adjusted Perspective, the podcast with chiropractic students. This is something that we've been thinking of for a long time now, and it's really awesome to see it finally come to fruition. But just to give you a little bit of background on us, we are trimester 6 students at the Palmer College of Chiropractic, Florida campus. And just to let you guys know that everything that we say on this podcast is solely our own opinion. We are not associated with Palmer College of Chiropractic at any time. We are not medical professionals, so make sure that you are not taking any of the advice that we are necessarily giving you. But the purpose of this podcast is to help anybody who is thinking about coming to chiropractic school, to help you make that decision, whether it's right for you, and then for students that are also in the field and just getting out into the field for the first time after school, some of the best things to help them and to help you all along your journey. So we hope to inspire, we hope to help educate you guys, and we hope to help educate the public and have a great time talking about chiropractic, because it really is an excellent profession. A lot of us are second generation chiropractors. We have family members that have been in the field. We know people who have been in the field for a long time, and it's been changing lives for over 130 years. We feel like there wasn't necessarily the best kind of media out there on YouTube and Instagram that accurately represented the profession, and the only thing that that's doing is just keeping people from coming to being chiropractors. So no matter what you guys think, whatever you guys want to do, whether you guys want to send us questions about chiropractic that you guys might have, or anything about the show, please reach out to us. We have platforms on YouTube, Instagram, and TikTok. Yeah, we have TikTok as well. So reach out to us on those platforms. We'd love to talk. But without further ado, let's get into it. The Adjusted Perspective podcast with chiropractic students. This is our pilot episode, episode 1, coming at you. So first thing we're going to do is we're going to kind of go around the table. We're going to introduce ourselves, and then we're going to talk a little bit on why we got into chiropractic, and I guess just our relationship with chiropractic before we came here, and then after being here. So who wants to go first? I'm thinking that Eddie
I'll take it off.
wants to go first. Let's do it.
My name is Eddie del Castillo. I'm a first generation American. I'm from West Palm Beach, Florida. That's where I grew up. My relationship with chiropractic before I got into Palmer was actually minimal. I don't have a family background in it. My background is in exercise science. I was a pre-med / pre-physical therapy student. And then whenever I was doing my shadowing and my observation hours, I just noticed a couple of things. Number one, the physical therapy side of things didn't interest me enough. It wasn't intriguing enough. It was a lot of protocols, a lot of repetitive action, and a lot of the times the patients would go in pain and leave in pain. I had a similar experience with urgent care, primary care, and the difficult places that I shadowed. I studied at Cornell College, a small liberal arts school in Mount Vernon, Iowa. And then finally, my exposure to chiropractic actually came indirectly from my parents. My mom had been seeing a chiropractor for about 10 years, and constantly over and over she was saying, go check out Dr. Max, go check out Max Health, go see it, go shadow, you might like it. And then Max, he's a good family friend, he kept saying come into the office. And then, so finally I went in like right before I was supposed to go into physical therapy school actually. And I noticed...
Anyways. Alright, keep going.
Right.
Get it out.
And I noticed a couple of differences that intrigued me. Number one, Max actually had a relationship with his patients. He knew his patients on a not only name and name basis, but on a person-to-person basis. He had gone to marriages, to birthdays, funerals, all of it. And the other thing is, it was the only healthcare facility in which people came in feeling not so good and left feeling better. So that made me start asking the question, all right, what is chiropractic? And after a couple of conversations with him, I went and I shadowed at Palmer College of Chiropractic. At that time, whenever I had decided to go, I still didn't know that much about chiropractic philosophy, scope of practice, or any of what it is. But throughout my time, I learned to fall in love with it, and the more that I've learned, the more that I've hung out with you guys, and the more that I've dug myself into the profession, the more that I've become emphatic about it and love to talk about it. So that's pretty much it from my end. So first generation chiro, first generation.
Carson.
Awesome.
Over to you.
Let's do it. Hey guys, my name's Carson Tuttle. I am actually from a town called Mukilteo, Washington, which is just north of Seattle. So I'm here across the country now in school. But about a year and a half into Palmer College now. And so I have a little bit different background than Eddie. I do come from a chiropractic family. And so my dad is a chiropractor. I have an uncle that taught at Palmer College in Davenport. I have several cousins that are current DCs. I have a cousin that's also in chiropractic school. So the Tuttle family kind of has a background of chiropractic, and I'm fortunate to be a part of that also now.
Chiropractic royalty.
Right. But so anyways, I grew up an athlete. I ended up getting my Bachelor in Science of Kinesiology from East Texas A&M, and I played basketball while I was there. So I've always been involved in kind of the sports and healthcare world since I was a kid. I grew up as a chiropractic kid, which growing up, when you're a chiropractic kid, life can be a little bit different than the people around you, just the way that you approach healthcare and maybe the way that you eat nutritionally and just getting adjusted on a consistent basis is not the norm, I would say. So I was exposed to that very early on, and I feel very fortunate that I was exposed from an early age. Growing up, going through high school and college, I wasn't set necessarily on going into chiropractic directly, but as I got exposure to different fields in healthcare, I had looked into physical therapy, I had looked into more training type roles, and just as I got educated and as I just spent time talking with my family about chiropractic, I just absolutely fell in love with it, especially by the time I went to college, and I started to really understand how the human body works and what it takes to really be healthy and well as a human. And one thing that really drives me as I'm in school now and that growing up that I learned was that chiropractic care it really is, like if we want to break the word down, it really is health care. They're approaching things from a perspective of keeping an individual healthy and functioning as their body should function, as opposed to trying to treat sickness. And so that's something that has been really big in my life. And when I think about what I want to do with my life, and I would say my ultimate driving purpose is to just be able to serve people at a really high level, I think that chiropractic is absolutely an amazing thing, a service that you can provide for people. And I love it. So excited to be here with you guys.
Yeah, thank you, Carson.
Yeah.
Hey, Gabe.
Alrighty, I'm Gabe Higgins. Nice to meet you guys. I come from a very light background in chiropractic. I have an older brother, about 4 years older. He was the first chiro in the family. And honestly, before that, I actually had no clue what chiropractic was. Never really heard much about it. But for about the first 4 years of my undergraduate, I was going to go to dental school. So I was full head over heels over dental. I switched up a little bit and started thinking about orthopedic surgery and dental. But it got to a point where I started shadowing, and a lot of the stuff I was seeing in the medical profession was a lot of medicine pushing. So it seemed that instead of actually treating the patients to really try to heal them long term and make it to where they don't have to come back, it was more of like, here, take this will take away the pain, but the pain will still be there. And that kind of pushed me away from like the MD side of things, whereas with the dental side of it, I always had a love of the whole body. I got into working out pretty young, right at the end of my high school age, and I just loved working with the full body, and I was like, do I really want to push myself down all the way to just working with the mouth? So after some deep thought and an upset dad for a little bit, I decided that chiropractic I think was a great choice for me. And early on, I kind of just like made that choice and didn't really put much thought into it. And since I've been here, I've learned more and more that this is definitely the place that I was meant to be at. And I mean, it fits me perfectly. I think what immediately told me that was the people that I surrounded myself with when I first got down here. I could just immediately tell that like they were my type of people.
Yeah.
So my main background is I went to East Carolina University for undergrad, and then I also studied at NC State over in Raleigh, North Carolina. So a lot of my background is in kinesiology, full body, and I think that's kind of what also really drags you toward chiropractic is what we'll talk about in a little bit is our large scope of practice. I love that, and I think it offers us a ton of opportunities. But yeah, I mean, that's pretty much my background, so we'll throw it over to CJ.
Great. Cool. Gabe is actually working on pioneering some. We're really becoming the very first ever chiropractic dentist. So really specializing in the adjustments.
Getting those specialties.
Like you sit in a dentist chair and he looks at everything and then he adjusts you.
That's it.
Yeah.
So it's a holistic way to take care of cats.
We're going to be adjusting Gomphosis joints.
Just wiggle them, give them a pop, easier than using a drill. But anyways, so my name is CJ Pachaka. I am from Poconos, Pennsylvania. I am a second-generation chiropractor. My dad went to Life University in Marietta, Georgia, and he had a great experience there. A lot of the guys that he ended up graduating with, like I still call my uncles, and I've gone and I've seen their practices. I've interned through them. So really, my entire life has kind of been engulfed by chiropractic. You know, from a young age, even if I didn't understand much about chiropractic, like I knew my dad fixed backs. And as funny as that sounds, so there's a story that my mom likes to tell. When I was in preschool, this one kid, I guess, kept saying that his back hurt, and I got so angry the one day, I was like, you just need to go see my dad, like he fixed his back. I was 4 years old. I didn't really know exactly what my dad did, but I'm like, hey man, he fixes backs. So as I got further into high school, early on in high school, really I just wanted to play baseball. Yeah. That was always my thing, like I wanted to get drafted, but I knew that I had to kind of dedicate myself to something else, and I really wanted to be something that I was super passionate about. My senior year, I did a paper on functional medicine. I was always very into the functional medicine side of things. I initially wanted to do business, but I'm like, I don't really like business, so I don't know why I would ever go in and do something like that. So all throughout undergrad, I really wanted to be a DO or an MD. I was thinking DO, but the plan was I would learn the medical side of things. I would get prescriptive power. I'd be able to open up my own functional medicine practice, but I still wanted to adjust everybody. So even if I went to medical school or DO school and I had an open license, I wanted to adjust people. But the only issue is my entire life, I've viewed healthcare through a certain lens, and that was through the lens of chiropractic. And Carson touched on it a little bit, same thing, or really with all these guys. But the one compounding variable between all of our stories is that we look at the body from an entire anatomical standpoint, and we try and figure out what is making the person sick, and then how can we prevent that stuff from happening in the future. I really didn't want to be a primary care practitioner, just taking care of people who were coming in for like just simple like aches, pains, fevers, sicknesses, and stuff like that. So being a chiropractor is awesome because it allows you to specialize a little bit more into that preventative healthcare side of things, as well as becoming masters of the spine, adjusting, and then other modalities in order to help along with that. So throughout undergrad, it's actually really cool. When I was at Northampton Community College, so I started at Northampton Community College, went to Campbell University, played Division I baseball there, and then I finished out at East Stroudsburg University where I got a master's program, and I met my current girlfriend Leah, who's sitting over there on the couch. At Northampton Community College, I had the privilege of learning under Zach Murphy. So Zach Murphy, as everybody knows, is Ninja Nerd. So I remember being in the room back there, and he was like the kid who was helping with organic chemistry and chemistry, and kind of getting to learn from him and everybody else at the Learning Center at Northampton Community College. I really developed a knack for science. And even though I wasn't great at it necessarily, I was in there all the time just because I loved being surrounded by like-minded individuals, people who were kind of working towards a common goal. So being able to learn under Zach Murphy, who has like 10 million subscribers now and a massive business, is awesome. Went to Campbell, had an awesome experience there. COVID kind of shut things down. Then I went to ESU. At this point, during COVID, I was like, I really wasn't sure if I wanted to go to the DO school now. I kind of put off taking the MCAT just because of everything that happened with COVID, so I just wasn't studying for it. I got my master's, got long haul COVID, got really sick, kind of took some time off, took a year off from school. And over that time, I opened up a baseball training facility where we did weightlifting and baseball-specific training with my best buddy, Vic, who is now a AA strength coach for the Tampa Bay Rays. So for the Montgomery County Biscuits is the name of the team. And we just had an awesome time, and I just really loved getting an opportunity to work with individuals who were struggling with stuff. And obviously, like I was only a strength coach at the time. I didn't have this expanded scope of practice. And the one thing that I hated was athletes coming into me and them having something that I wasn't able to actually help, even if I knew how, because I didn't have that scope of practice. So I said, even if I only work with athletes or if I work with general population, I need to go back to school. And then that's what led me back here and led me to you guys. And thank God I did, because it has just been one of the biggest blessings to come to an institution like this and learn as much as I have under the professors that we have. And that is going to roll us right into our next topic. Some misconceptions about chiropractic school is that it's like a couple month course, that it's only a year or two. That I had somebody ask me after I went to school here for like a trimester, and so for those of you who don't know, that's 4 months. went here for a trimester, and he's like, CJ, so you guys have tests down there? It's like, yeah, we have tests. But even though it isn't exactly like, or not even really close to a medical education and an MD or DO program, even like a PT program, they still train us to be experts in the human body. And then our scope of practice comes from teaching us things like comprehensive adjustment courses, modality courses, learning the human body, so human anatomy 1 and 2, physiology courses, over the course of 9 trimesters in the classroom, and then 1 trimester that we go on a preceptorship, which is kind of like our residency. Not really, I don't want to call it that. It's more of like an internship where we pick a doc, we go to the field, and we learn from them. So it was a very comprehensive education for anybody who was wondering. And I'm thinking I'll pass off to one of you guys, but we'll roll into like the scope of our course load. Right? You want to do course load?
We can talk about scope of practice first.
Scope of practice?
Yeah,
All right,
scope
take
of
it away
practice.
then, Edward.
So, in order to define scope of practice, or at least the chiropractic scope of practice, we have to think, what is scope of practice, right? Scope of practice, it is defined as the regulation of professionals in a specific jurisdiction. It is used to legally create boundaries by restricting the allowed activities of a specific profession. Its purpose is to protect the public by setting legal limits on what a provider can do. So, what does it mean? It means what can or can't we do as chiropractors? This varies on a state-by-state basis, right? And some people will think like, oh, that's kind of weird. Well, most healthcare professions are like that. The only healthcare profession that has a broad and unified scope of practice is medicine and now the DOs. And the reason that is because they were the first ones to get licensed. The AMA put forth a concerted effort to make sure that other healthcare professions didn't kind of step in their boundaries. And that's the battle with the AMA is going to be a topic for a different episode, but that's just one of the things that we want to talk about. So like I said, chiropractic scope of practice is a state-by-state thing. Some of the states are very liberal, one might say, in what we can do. Like Missouri, for example, has 97 procedures which chiropractors are allowed to do, and other states like Texas only allows 43.
And for anybody who's wondering where we're getting this information from, this is from eScience Direct. These charts that I'm pulling up, they're a little blurry on the screen, but if you're curious as to where we're getting that stuff from, is going to be, there's 3 tables under eScience Direct. That look just like this, but continue, Eddie.
But yeah, as you can see there, like these are all, I'm not sure whether that's the soft tissue or the radiography or the manual therapy one, but there is a plethora of things that we can do as a profession. We are able to diagnose neuromusculoskeletal disorders. We're able to order radiographs. We're able to take x-rays ourselves. We don't need to go like through another provider to order any sort of imaging or lab work. And like I was saying before, it's a state-by-state, jurisdiction-by-jurisdiction thing. We are allowed to adjust and manipulate the spine in all 50 states, right? There's only one state which we're not allowed to adjust extremities, and that's Hawaii. And then other things like, let's see, where's this list? Like extremity examinations, orthotic supports, spinal supports, lifestyle counseling, neurological examinations, vitamin supplementation, lots of other things, right? Mm-hmm. So when somebody asks you, like, what does a chiropractor do? It's not necessarily just crack and get out, right? We are trained to, like CJ was going on about the course load, we are trained to diagnose and treat neuromuscular conditions, and we are also trained to do a whole lot of other things when it comes to our role in healthcare.
And one of the other things too, so out of everything that Eddie was just saying, so people often like to say like, oh, chiropractors real doctors? Chiropractors aren't real doctors. I think it really just comes down to comparing apples to oranges when you try and compare us to medical doctors. Obviously, we don't have the same kind of open license, but we don't prescribe medication. We're not able to do surgery or anything like that. There are a couple exceptions in terms of injections, right? Being able to do stuff like IV therapy, depending on the state that you're in. But overall, we stick to pretty much just adjusting the spine and treating these neuromusculoskeletal conditions, but not necessarily limited to that. We are trained pretty extensively in reading radiographs, taking x-rays, so we can get x-rays, MRIs, CTs. You can get additional certifications so that you can read these for other healthcare professionals, whether that be an MD or a DO that is sending you imaging. But what they do is they train us to use all these different kinds of imaging modalities, instrumentation, so that we can figure out what's going on with the person, recognize red flags if there's something that we can't necessarily take care of, and send them off to a healthcare practitioner that can take care of what we saw on the x-ray. So even though chiropractors aren't real doctors in the sense of being an MD or a DO, it doesn't mean that we don't work with all these other professionals to help a single person out. right? It's not that chiropractors are versus the world or anything along those lines, but if there's something that I can't take care of, if I feel this person needs medical attention, I can recognize that through a comprehensive exam and I can send them to somebody else. And same thing, if you go to your primary health care provider and you have something, let's just keep it simple, like back pain, then there are a lot of primary care physicians and practitioners that'll send you to a chiropractor. So we're working hand in hand with the medical community in order to help get people better, and that kind of envelops our scope of practice as a whole.
100%. Do we want to talk about what is chiropractic for a second?
Let's do it.
Yeah, because I think
Let's
before we can talk about the curriculum, before we can actually understand what the scope of practice is, it's important to define what chiropractic is, right? Yeah. Chiropractic is looking at the body, like you three had said, it's looking at the body as like a whole system, right? It's holistic care. And most importantly, we work with the spine. And the whole premise of chiropractic, as Leonard Fay puts beautifully, is that the human body is endowed with certain inherent qualities that provide for the protection, maintenance, and restoration of health, of which the normal function of the nervous system is a major integrating force. It is reasoned that when normal transmission and expression of nerve energy is interfered with, particularly in the spine, pathophysiological processes may develop. And I think that this definition of what chiropractic is perfect, because it gives the way for our lens of looking at healthcare, right? While other professions may look at the symptoms first and may look at, okay, this person comes in and they have high fever, they have cerebrospinal fluid buildup, whatever it may be. They look at that and they treat that. On our hand, we understand that the human body is designed to be healthy. It's designed to keep itself healthy, and that communication is done through the spine. So we correctly infer that if the spine is functioning properly, if the joints of the spine are functioning well, then health will be throughout the body, and you can stop the process of the pathophysiological process down the line. Yeah. So a chiropractic is any professional services provided by a chiropractor within their scope of practice, whose aim is to restore and maintain health, right? That's our biggest thing. Is we look at the body first, we look at the patient as a whole, we evaluate it with the education that we have, and then with that, we treat them accordingly.
And to give it, because you just read that definition, and it's probably a little bit more of an in-depth definition. So for those of you that are watching that are maybe new to chiropractic, really just trying to kind of feel it out, I feel like a very dumbed down from that version definition of it is, from what I have, is that it's a healthcare profession focused on the diagnosis, treatment, and prevention of mechanical disorders of the neuromuscular skeletal system, especially in the spine, as you said. The main foundation lies in the idea that spinal function affects overall health through its impact on the nervous system. So that's just more of
it's good. I like that.
That's a good one.
Easy, dumbed down one. So hopefully, if anybody's watching, because that's the definition that I would follow as well. Yeah. But Leonard Fay is a very in-depth man.
Right.
He is.
And I think just to go along with what you guys are saying, at least in my life and my background with friends and family that I communicate with about chiropractic, I think there can be misconceptions about what we're trying to do. Currently we're students, but as doctors, what we're trying to do and how we affect the body is that we're not just crunching bones. We're not cracking back solely. We really take this foundational piece of our body called the central nervous system. It's really important to us in our practice because our nervous system controls every function that we have in our body. So whether we're looking at our respiratory system or our cardiovascular system, or if we're looking at our musculoskeletal system, our body has the ability to receive information from the environment and to act on that information from the environment, to think, and to control our various functions through our nervous system. And so, to get into, not to get too deep, but we look at structure and we look at function. So people typically think that okay, all you're doing is you're looking at these bones, and are the bones out of place, and you're just gonna put the bone back, and we don't think that there's anything else to it other than just dealing with bones and crunching those bones. But really what we're trying to do as chiropractors is to restore function to the nervous system, which is the entity in our body that does control everything, and it maintains our health. And as soon as that gets out of whack, if you guys, in a really, crazy example, if we didn't have a brain, we probably couldn't function very well. We wouldn't be alive if that was the case. But so I just think it's important to note that if you're a prospective student, or just early on in your career, the nervous system is really, really, really important to us, and that's why we call it neuromusculoskeletal experts in the field. Like, we want to be a neuromusculoskeletal expert, because not only is it the bones and muscles that we're trying to work with, but we really are trying to have the nervous system function at its full capability so that we can have health.
Yeah. And I think, neurophysiology, like, basically kind of like, that's like the word that just kind of described almost everything he kind of said. That's a huge portion in all of this, because in chiropractic itself, that kind of helps us understand how, like, spinal function affects the nervous system activity. So to go along with what Carson was just saying, that kind of shows us how an adjustment might influence pain, help pain, make it worse, how it changes. Proprioceptions, like how your body kind of perceives itself, or just the autonomic tone.
Yeah, and going off of what Carson just said, I've heard a lot of our professors at the school say that before we are anything, we are spinal and central nervous system experts, right? And our curriculum reflects that. We take a lot of neurophysiology classes, spinal anatomy, gross anatomy, and so before we are anything, we are experts in the spine, its function, its purpose. Same thing with the central nervous system. That's our bread and butter. We just we take that information and we apply it through our hands to help get our patients better.
And I think where a lot of the misconceptions come for what chiropractors are experts in and what they're not experts in. So again, there are different terms that are thrown around in the chiropractic sphere, like you're a chiropractic neurologist or a chiropractic orthopedist or a chiropractic pediatrist, like you specialize in pediatrics. Really, if a chiropractor is calling themselves an expert in something, or they are advertising an expertise, it's because they've gone and gotten additional training and certified through either the American Chiropractic Board or International Chiropractic Board and what's called diplomates. So just like a medical doctor or a DO can go and get an additional certification in something outside of what they are board certified in, then you could go ahead, they would go and get a certification for that. There are actually opportunities that are now being created, especially at Parker. I know Parker was talking about their seminar with master's programs, so that chiropractors could be recognized as a specialist outside of the chiropractic sphere in the United States, which would be the first time ever that something has gone along like that. But first and foremost, you can be a chiropractic specialist in something, but it's not the same thing as being a medical doctor specialist in that same thing. So I just want to make that very clear so people don't misconstrue that like we can be specialists in something else, because first and foremost, we are a chiropractor. Right? If you are a chiropractor that specializes in pediatrics, the same principles of chiropractic that are applied to every chiropractor are still going to be central in your practice. Right? We focus on the neuromuscular skeletal system, we focus on how the nervous system is impacting the body, and then we analyze the entire body from a musculoskeletal standpoint, and then we adjust and we do everything we need to do in order to get that functioning properly. And that has always been at the foothold of what chiropractic has been for 130 years. And no matter what, chiropractic will typically hold adjusting at the center of what it is. Okay, so that's kind of the gist of chiropractic expertise. And but all in all, we're chiropractors, and one of the definitions of what chiropractic is and how it's developed over the years. So obviously chiropractic was started by D.D. Palmer, passed on to his son B.J. Palmer throughout the early 1900s. D.D. Palmer studied, and we'll do another episode that is full of history and we can really lay it out for everybody. But D.D. Palmer studied for 10 years. He was a magnetic healer, but back then that was really kind of just a massage therapist, and they utilized some magnetic healing just to clear up some confusion there. But he studied the human body for 10 years, trying to figure out what made the body sick. And just some of the inner workings, because obviously at the time where the medical community was at, it was a lot of chopping off limbs, making people throw up, making people go to the bathroom, making people purge as a way to take care of them. Pharmacology was very primitive at the time. You had very basic things like when was penicillin first invented? Or microbiome? Never mind. That was a bad question. That was exactly when it was invented.
We might have not done that well.
But it was a legitimate conservative attempt to make sure that people were being taken care of in a way that actually made sense. So people think D.D. Palmer was all just about adjusting. Adjusting was a way that he found out that he could take care of the body, when in reality he focused on something called nerve tone, which we've already kind of touched on. But the nervous system's ability to distribute and control function throughout the body, and then how can we affect that if something isn't working properly. So one of the more conservative definitions of chiropractic, at least early on, was the adjusting of vertebral subluxation through the science, art, and philosophy of chiropractic. to help nervous system tone. That was one of the original definitions. Obviously, chiropractic has developed over the years, and we have advanced. But from a fundamental standpoint, that something that is 130 years old and kind of remains true at the very center of the profession is the adjusting of vertebral subluxation. But we can get into that topic on another day.
But I feel like what you just talked about, though, is a great segue into talking about, curriculum as chiro students versus the curriculum of med students. So, I mean, we talked about that image that was going around on Instagram for a while. A lot of chiropractic
I got
students.
one of those.
I have it pulled up right here. It's probably a little bit different.
This one's just a school hours chart, but I'm pretty sure I know which image you're talking about.
Yeah. So I have that image here. Looks about the same. Yeah, it's the same. So I thought I would kind of like break those down and kind of talk about the misleading part from the chiro students that were posting it on their Instagram stories and saying like, "Oh, look at us," but then also like the strength that shows from that, because I do think it has some legitimacy for us, but it also, with what we talked about, forgets a lot of stuff that is like that you go through in medical school. So I won't say all of these. I'll put the image up a little bit bigger for you guys so you guys can see it. But to just name a few of them, in chiropractic school, we have 540 hours in class for anatomy, whereas medical schools have around 510. Microbiology, we have 120 hours. Medical schools have 115. And then even something as like physiology, 240 for us, 325 for them. So there are some where obviously they have a lot more, and then there's some where we have a lot more.
And this chart real quick was posted by Community Chiropractic of Acton. I'm not sure the year, but there are similar charts that typically come out every year and float around Instagram and TikTok, and people end up posting about it.
And I mean, because going back to the, us being experts of the nervous system, as you can see, like reflected in our course load, we take 320 hours of neurology compared to 110. Like CJ said earlier, it's comparing us to MDs, it's comparing apples to oranges. We're different, and we have our things that we specialize in, and they do theirs, but we receive a very vigorous and in-depth education.
Yeah.
We are, this is a legit graduate school program.
Well, at the bottom, in grand total course hours, this is where the discrepancy comes in. We have 4,485 hours.
On average.
Obviously schools are going to differentiate. Same thing with med school. The average for med schools is 4,250. Now, a lot of students like to post this on their Instagram stories and kind of like throw it out there as like, look at us, like, we're actually doing this more than MDs. A big thing is like, yes, I do think, this shows that on average we are in class more, but I think a lot of
not like everybody goes to class.
Yeah.
You know what I'm saying?
But I think the big
if you go to every class,
the big thing to remember though is like, we're in class this much, but when you finish class in medical school, you then go into your clinical rotations, and that's like what 3 to 5 years for most people,
depending on the specialty.
And
well, there's a difference between clinical rotations and residency. But so that's not 3 to 5 years necessarily. But once you get done in the classroom, so I remember when I toured Campbell's DO program. This is back in 2018. They said you're typically in the classroom for 4 hours in the morning, and you go over to the clinic for 4 hours, and that's not necessarily counting your cadaver time that you spend in there dissecting. So there is a difference there, and then something else that we don't necessarily talk about. Here at chiropractic school, you're not competing for a residency. So all the education that you get out of this is going to be what you want to get out of this, and of course, the kind of grades that you need in order to stay in the program, which isn't overly high, but at the same time, I am not sitting here and competing with all of you at this table for like a surgery residency, right? And I know a lot of the stress in medical school comes from making sure that you're competing in these very tough classes in order to make sure that you get the kind of profession, the kind of specialty that you want, depending on what you want to go into. And then another key difference that we have to remember when we're going over all this, we learn the human body from a chiropractic perspective, they're learning it from a medical doctor perspective. Because they're able, again, to do surgery, they're able to prescribe medication. And those two main things, as well as stitching people up, there's a lot more within their scope of practice for stuff that can go wrong and how they can help and hurt people than necessarily for chiropractic. We have to remember that chiropractic is a conservative healthcare profession, right? Adjusting, we can talk about the risk of vertebral artery dissection. We can talk about the risk of hurting people who are hypermobile. But at the end of the day, the research is few and far in between saying that chiropractors hurt anybody, especially when you do a thorough examination and you do what we are taught in school and you do what we are supposed to be doing. So medical doctors, it's just a different kind of scenario, it's a different kind of place, different kind of intensity, and you're learning it a lot of, even though you're learning the same life science, you're learning about it in a different way because you have to apply that through medication and surgery and through a wider scope of practice.
Agreed. I mean, medical doctors look at a lot of things post issue, like after, like the patient presents with issues. We are a preventative science. Our goal is to maintain the health of the organism as a whole. Their goal is to fix the majority of the issues that they have, like whatever neurological, pathological issues they might have. So,
and it doesn't mean that there's not going to be overlap in a chiropractor not necessarily knowing more than a medical doctor, or a medical doctor not knowing more than a chiropractor. So it all kind of depends on the kind of physician you go to, right? We have good chiropractors and we have bad chiropractors. We have great MDs and we have bad MDs. Same things with DOs, same thing with PTs, same thing with OTs. So just when next time you go to a chiropractor, understand that they were given this intensive life science course load as well as modalities and with adjusting and everything, and they are experts at treating the body the way that they were taught to treat it, and it doesn't mean that they can't understand it as well as anybody on the planet, especially when you have someone who's been in practice for 20, 30, 40 years.
Mm-hmm. Exactly.
And there's another chart on here that we can talk about. I think this is the one that was going around Instagram for a while, where they put the white coat next to the white coat. I found it on Reddit.
Oh boy.
So it's just it's kind of the same thing, but this is a really bad misrepresentation of it. So again, I like the charts because they show how many hours that we're at least supposed to be in class compared to medical doctors, but there's a lot of stuff that isn't mentioned on the medical doctor side. So as much as I appreciate it, it's not exactly accurate for what we're trying to accomplish and what we're trying to tell the public.
I think the most important thing we can take from these charts is not necessarily how we compare to medical doctors, but just that we do receive a vigorous coursework. We do receive a great education here, and like whatever it is that we're talking about from the lens of chiropractic, we are experts, right?
Yeah,
that's the most important part.
I think of like with what CJ was touching on, you do have students that don't attend class, and we do learn things a little bit differently for our scope.
Mm-hmm.
But I think the biggest thing to know is, like, especially if you're considering going to chiropractic school, is you're going to get whatever you put into it. So
100%.
I've gained a lot of knowledge on things that we might have like learned in class, whether that be like, something like, a specific bone cancer or like pathology, where I decided that I wanted to know more about that. So then I researched a lot more. And so like for me, on the stuff that I'm really interested in, and for whatever you guys are going to be interested in, once you get here, you're going to kind of find that groove and that path, and that's where you're going to start kind of differentiating yourself. Is you're putting more into it than some of the other students, and you're going to learn a lot more and be more knowledgeable following that.
I'm just looking at the comments and see if there's any good comments. No, there's nothing too crazy.
Yeah, I don't think Reddit's going to be the best place to find some constructive criticism. But
what do you guys want to go into? We want to go into this part.
Gabe brought a pretty cool point for the people that are thinking about going to chiropractic school. It's let's go like through each one of us. Like, if you are considering chiropractic school, like what should you prepare for it, and then how to know if chiropractic is the right way for you.
I like that.
For me, one of the things that I would tell like prospective students is be prepared to think critically, right? A lot of one of the things about chiropractic school is because we get all of these diagnostic classes and we get all these health science classes, and yet our main tool for helping the patient is through the adjustment. You have to be able to look at the body in a critical thinking perspective, because we don't necessarily have protocols, right? Like we don't have like a torn ACL protocol or a torn meniscus protocol. You have to take the information that you've learned here and or by your own studies, like Dave was talking about, and apply it to a real human, to a real patient who's hurting or who's dealing with these issues, and be able to help them from that holistic and preventative perspective.
And it's not to say we don't necessarily follow protocols when we are taking care of someone with an ACL injury. Obviously, we would follow what the research says when it comes to taking care of something like that. But continue.
No, I mean that would be probably my biggest point. Just make sure you're prepared to critically think, and then also like, are you the kind of person that wants to move away from the way that the United States of America is moving, which is a lot of medications, a lot of surgeries? Do you want to try to take care of the body in the most natural approach that we can? That would be the two biggest things for me. It's do you want to be holistic, and two, like, are you ready to critically think?
Go for it.
And then that also brings me back to something that RFK said recently. And one of our professors, Dr. Norkus, told us a story about someone who had adjusted RFK and really helped him out with whatever voice thing he has going on. I'm not exactly sure what it is, but he had a quote fairly recently just saying that everybody knows what RFK is trying to do within the American healthcare system right now, as the director of health, whatever his title is. And now, love him or hate him, I know it can be a very controversial topic bringing up someone like RFK. But what he says about chiropractors, the other day really reigns true. And say chiropractors are my kind of people. They're willing to challenge the way that we think and be able to change paradigms. So if you truly want to be a medical doctor, don't come here. And there's nothing wrong if you want to be a medical doctor or a
you're
DO,
gonna help a lot of people that way.
right? And you're going to help a lot of people. You're just helping them for different reasons. And again, there is overlap, but understand when you come here, you have to be able to critically think, and you have to know anatomy inside and out. You have to know how the body functions, because if you think you're going to come here and you're just going to push on someone's back and be able to help them, it's not as simple as that. And I know some kinds of adjustments can be learned fairly easily, right? We know everyone who they stand behind their buddy before a basketball game and they pick them up and they crack their back and they're like, hey man, like I'm doing the same thing as a chiropractor. There's a lot more to it than that. But if you're willing to help people from a holistic standpoint, if you really just aren't turned on by the way that medical doctors take care of people or within that system, then this could be the right place for you. But understand, like, it's not necessarily easy to become experts in the human body and to learn how to critically take care of someone, because there's not a single, we can't prescribe, right? You can't prescribe pain medication. You can't prescribe anything else. You can't, heart medication, things for cholesterol. It doesn't matter what it is. You have to be able to work with the person to change their lifestyle and know the human body well enough that to know if you make a change or adjust one area, it's going to affect the body in another area. So I would say it's definitely not for the faint of heart. There's definitely a lot of critical thinking that's involved with it, but it is very rewarding knowing that everybody in this room knows chiropractors that have been able to take care of people in monumentous ways.
Yeah. I would 100% agree with what Eddie and CJ just said about it is going to take a lot of hard work. It is going to take a lot of time reading and studying and really trying to understand. All good. Really trying to understand what it takes to have a healthy human body and the ins and outs of anatomy and physiology. And so you will be spending a lot of time in the books, trying to watch YouTube videos to help you further understand topics, trying to write out kind of critical thinking exercises to help you think about patient management and how you would handle somebody if you had, a low back pain or, we use these general terms, but any specific diagnosis that somebody comes in with, you're not going to be going and saying, well, this medication lines up with this specific drug, and so this is what we do. You have to be able to, like you guys said, critically think about a patient standing in front of you, and not only from the perspective of just what their anatomy and physiology is telling you, but like, how is the patient emotionally? What are they scared of? What are they? And so we talked about some of the things that, you really have to be prepared for with it, but I will also touch on the absolutely like amazing benefits of it, because if you're thinking about becoming a chiropractor, you have an unbelievable opportunity to serve people. You have an unbelievable opportunity to get face to face with someone and really connect with them. And health is a vulnerable thing. Like it does not feel great emotionally to be sick or to be in pain. And so, you put trust in somebody when you show up to a doctor's office hoping that they can help you with whatever condition you're facing. And typically, you might have some depression around the topic, or you might have some fear around the topic. And so as students right now, just really being able to dive in and think about how we can help people, not only from the perspective of what we can do with our adjustments, but how we can be there just emotionally for somebody, providing them with the support and with the information that helps them make decisions for themselves at home that's outside of just taking a medication, or is outside of, just lay down and we're going to do this surgery on you. We really get to be involved with the kind of the lifestyle of the patient. And so if you are somebody that is really interested in being able to really connect with people, being able to lay your hands on people and use these incredible tools that we've been given to help people's health, I think that chiropractic is an absolutely amazing opportunity. And like they said, It takes a lot of work. It takes a lot of effort. There are a lot of hours put into it, and late nights and studying and all that sort of stuff. But it is absolutely worth it when you see the friendships that you get to make with other people that are also pursuing this field of trying to help and serve others through chiropractic care. And so I would highly, 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 highly encourage it.
That was beautifully said, Carson. That was awesome.
Love
yeah,
that.
yeah.
Gabriel.
You guys touched on a lot of, I feel like the big points, the stuff that, like if you're already kind of leaning towards chiropractic, the one thing that I would recommend a lot of people read is a book known as The Social Transformation of American Medicine. It's written by Paul Starr in 1982. This book really touches a lot on the historical context for how non-MD providers were marginalized, and it kind of doesn't necessarily speak on chiropractic specifically, but it is kind of like a framework that explains why chiropractic was excluded from the early 20th century organized medicine, and the reason why I recommend that is, as CJ said earlier, you have good chiros and then you have some bad ones, and a lot of those guys you might see with the mic laying under the back on TikTok, and they're just absolutely just trying to crack somebody's back as loud as possible. But the same thing goes with MDs. I truly believe. I do think that there are some MDs that might not necessarily put the patient's health themselves first. Where on the other side, you have great MDs that they'll ask all the right questions that you really should know about a person's lifestyle itself, instead of just sometimes throwing just medicine in their face.
And everyone, I just want everyone to understand, when we use terms like that, we're not trying to offend anybody, right? We're not saying that the medical doctor that you go to is purposely trying to hurt you or anything like that. I don't think anybody at this table believes that medical doctors are bad for America or trying to kill, but we are just trying to put it in perspective of the history of chiropractic and what has kind of happened to us over the last 130 years, because despite the terminology, we're not, at least not all of us, we're not quacks.
Yeah,
Straight
up. Where I was going with that is, it has a lot of key themes in the book. One of the big ones is medical institutions and the power that they kind of got over with the AMA as well. And I think one of the larger themes itself is the shift of the American healthcare system from more of a patient health perspective to a more of a business model. And I think, like I was saying, is there are a little less prevalent nowadays, but there are a big side of the American healthcare system has become a business. You have more and more privatized hospitals instead of back in the 80s it was a lot more charity type hospitals.
100%.
And I'm not sitting here obviously trying to say all MDs are money grabbers, because the same argument can be made for chiros. Is that you have some chiros that you come in, you might drop $150 on an adjustment that's cash based only, and all they really do is just adjust your neck, your thoracics, and your pelvis.
Yeah, no evaluation.
Yeah, don't evaluate you. They just kind of rack it and crack it. But that is just a book that I would really recommend. It really kind of gives you insight into the healthcare system as a whole, and it'll kind of help you to see if you're more on the fence of maybe I want to be an MD versus I want to be more of a holistic practitioner, and you can kind of see the main changes that the AMA had and how more holistic practitioners practice nowadays.
And I think that point that you said, the capitalization of healthcare, is one of the things that pushes a lot of students towards chiropractic, right? I think everybody's heard the horror stories of pill mills, where they have these medical facilities that are up, and their only purpose is to sell as many drugs as they can. Those get shut down because nobody wants that. But and I don't think that any of us are saying that your MD is a bad guy, but rather than the healthcare system today is leaning towards profits over patient outcomes. And that's one of the things that as chiropractors we're proud to be staunchly or firmly against. We are 100%, our only goal is patient outcomes, right?
Yeah,
the good ones of us.
We can't speak for all chiros, because I think no matter what profession you go into, medical or not medical, you're going to have the good and the bad. But I would agree with you. I think everyone here at this table, and I would hope and believe that a lot of our fellow students in our class really view it the same way. Like, we really want to get our patients in, figure out what the root cause of the issue is, and hopefully, within, whatever that treatment time is, get you out and back to normal. And, if you want to keep coming back, you can, but our main goal is to get you healthy so that you can, go back to daily living, especially if, the type of injury you have is affecting your active daily living. Main point is, we can't speak on all chiros, and we can't speak, on all MDs.
You can't speak on all MDs.
So this is just kind of like, I brought that up mainly as a point of like, this was kind of like, my brother recommended me this book while I was at NC State, and that really shifted my perspective on a lot of things. So, I think it's a great read.
And just because I know it's a super popular topic going on right now, I know there's a lot of conversation that goes on, especially on college campuses, between socialized medicine, should healthcare be free, capitalistic medicine, the downfalls of capitalist society and how it approaches healthcare. But at the end of the day, no matter what side that you're on, it's like physician burnout is a very real thing. Most healthcare professionals, whether they be nurses or MDs or PAs, or even chiros in some ways, are experiencing burnout. There's not enough people to be able to handle the burden of the healthcare crisis that's going on in America. But at least as chiros, when you leave chiropractic school, obviously you can go work for somebody, but a lot of people go into private practice, and then you decide how you take care of your patient. You decide the amount of time you want to spend with them. You decide what the standard of care is going to be, and you can go cash-based or you can go insurance. But the glory of going cash-based, being your own boss and taking care of patients the way that you see fit, is that you don't have to bow down to anything, and you can give people the kind of care that you truly deserve, that they need. Right, so it's just another way that we can approach healthcare, because we see everything that's going on. If you want to go help out the MDs and the DOs, and you want to operate in that system, that's great. But know that being a chiropractor, even though you don't have the same kind of scope of practice, you have the opportunity to make just as big a difference in people's lives with the time you spend with them and with the kind of treatment that you can give them, with the quality of care that you give them. And also, another thing I wanted to say, I love that book that you brought up, Dave. I want to give it a read. I love the topic of it. A lot of the misconceptions that you hear about chiropractic came from conceited attempts by the AMA in order to be able to shut people down. So chiropractic was heard in a seance, or a lot of these misconceptions might have been talked about by chiropractors or perpetuated by chiropractors, but it was a defense mechanism to make sure that we could still exist in the early phases of the profession, from the years like 1900 all the way up until the 60s, 70s, and 80s. So things like D.D. Palmer heard about chiropractic in a seance. He talked about it in his personal journal, saying that that was not true. He said that so that we could exist in more of a space of something like Christian Science, because thousands of chiropractors were being thrown in jail for helping people.
Right. So
stuff like that, lies about B.J. Palmer trying to kill him to take over the family business. It was all magnetic healing. A lot of that was either a defense mechanism to protect us from prosecution from the law. But overall, chiropractic is the science, art, and philosophy of healing spinal dysfunction. That at the very basis of it, that's what it is. That's what it always has been.
And kind of going off the point that you just made, I think it's a cool point. Recently, we were at Parker's seminar in Miami, and we got to listen to an amazing, if you haven't heard of her,
I was just about to bring her up.
she's awesome.
Dr. Heidi Havoc is absolutely incredible in the work that she is doing in chiropractic research right now, and trying to bring just the research in chiropractic, just advancing that whole field right now. And what she's doing is incredible, so maybe we can link some of her stuff. But Heidi Havoc, we got the opportunity to meet and talk with her, and she presented at Parker's seminar in Miami, a conference we all just went to recently. But one of the things that she talked about, and kind of going off the point that you just made, with the attempts to silence or suppress chiropractic early on, is we didn't start out as a $1 trillion industry funded by billionaires across the world. Mm-hmm. It started with who a lot of people outside of the chiropractic world look at as a crazy man, who ended up bringing this profession to light. And might I add, manipulation's been around for thousands of years. It's not new, in terms of it was invented in 1900, but D.D. Palmer did bring it to light into the profession it is today in that time. But chiropractic has survived and now, it, as a profession is flourishing because of patient results. It's not a matter of, funding and pushing ideologies and, any of that sort of deal. If in reality, it's quite the opposite. There's been quite a bit of suppression that's been trying to happen from the other communities, medical community. But the patient's response to chiropractic care is really what has driven this profession forward, because you can't deny the results. I mean, we all, like me and CJ, come from chiropractic backgrounds, and we've grown up hearing about the miracle stories of what chiropractic has done for people. The profession wouldn't be around if it didn't work. If we couldn't, if results weren't happening.
You can only sell snake oil for so long.
Yeah, you can only sell snake oil for so long. Like,
yeah.
Eventually it dies out and people start, catching on this is, fraudulent, but it's not. Chiropractic has provided tremendous results across the board to various different types of issues, that we experience in our health. But I just think it's really important to note that chiropractic wouldn't be here if it didn't work. And it's because of the patients continuing to come back and saying, I find value in this. I find that this has dramatically improved my life. And so, while there is tons of discussion on what does the research say, and, people trying to, badmouth maybe the profession that we're in, the reason it has existed for so long and dealt with the persecution in the way that it has dealt with it is because we get results as chiropractors.
One of my favorite quotes that came up from the philosophy panel that we were all fortunate enough to participate in a couple of months ago was chiropractic survived for over 130 years based off nothing but merit. Right?
Yep.
Like, we didn't get the funding, we didn't get all of the positive media. In fact, we got a lot of negative media, and we still do to this day. We have survived off of results, off of merit, and like you said, all the research. I'm really excited to get into the research with you guys, because I think. Even though a lot of chiropractors even will say that there's not much chiropractic research, we have so much.
Well, let's bring it up.
We have some awesome research.
So I wanted to, because when you guys were mentioning research, it's just a simple test, and obviously, I haven't vetted all these research articles. I'm not saying they're all exactly about what chiropractic is or what we need. So just a simple Google Scholar search of the word chiropractic, 339,000 results. Now, if you open that up to something like manipulation, and type that in, 5.8 million. Yeah. And then if I add another word to it before, spinal manipulation, 1.4 million.
Yeah.
So even though we try to separate ourselves from how osteopaths manipulate the body, that's why we say we like to adjust. We like to have a specific reason and a specific methodology in how we manipulate. That's why we call it adjusting. There's tons of research that's gone on over the past 100 years to show the benefit of what manipulation is on the body. And I want everyone to understand the difference between adjusting and manipulation. It's really manual therapy research and pharmaceutical biochemistry research is there's only so many ways that you can research manual therapy, especially as a double-blind randomized control trial. Because how are you going to blind both the practitioner and the patient and the results of it, right? It's not as simple as giving out a medication. So just because we may bring up some research from the 80s or the 90s or the 2000s, it's good research, right? And we have tons of case studies. Chiropractic is more so goes off of case studies, looking at what practitioners have done in the past, or doctors of chiropractic have done in the past, trying to apply science to their theories, but then looking at the results they got through the methodology of how they were adjusting and treating their patients. So you guys like Dr. Thompson, Webster, Gonstead, Dee and BJ Palmer, Leonard Fay, Henry Gillette, a million, and then everybody, especially people like Heidi Havoc, who have been researching chiropractic and have been treating patients for 130 years, right? And we'll talk about Gonstead another time, but Clarence Gonstead treated over 3 million patients in the course of his almost 60-year career. Yeah. So we take the knowledge that our forefathers did before us, we try and advance it, but what people also need to understand is chiropractic is a science and an art and a philosophy, right? We have our philosophy of how we want to take care of a patient, that drives the science, which drives the art, and vice versa, and it works in a trio, a triangle, just like that.
Yeah, and to go back to Dr. Heidi Havoc, the one thing I will say, we get a lot of results when you look up spinal manipulation. Now, I will say this is just a base lookup, and what we learned very on with Dr. Krabby is there is a lot of research that just was put out via the AMA because they were trying to discredit chiropractic as a whole. So a lot of our studies, like you said, are really case study based, And I think a lot of people's argument with that is some people will say, it's like, oh, that's just like word of mouth. Like you're just kind of like saying this and that. The big thing with Dr. Heidi Havoc, for those of you who don't really know who she is, I can't remember if you gave any kind of a introduction for her, but she's a neurophysiologist.
It's a tough word.
Chiropractic.
It's a long word.
Yeah.
Chiropractor. She's a great speaker, as we learned this past weekend. She's an author, and the biggest thing is she's a very prominent chiropractic researcher. And the huge thing with what she's researching that she spoke about to us, which I love like neuroanatomy, I love neurobiology, I'm a huge fan of all of that, is she's actually studying the effects of spinal manipulation on neurophys.
Yep.
How spinal manipulation changes or activates certain parts of the brain. Now, I believe she was talking about like prefrontal cortex activity a lot.
Yes.
And so I think our biggest obstacle to this point is, we have a lot of these case studies like, oh, like, I know, I mean, correct me if I'm wrong because I think you're more knowledgeable on this, but like a lot of the stuff that Gonstead, kept and wrote down was when you adjust, like sometimes when you adjust a specific spinal segment, it has a result on a specific like visceral area.
Yes, and that was
like
pretty much, and that was the premise of chiropractic for years and years and years. Like you had the sympathetic nervous system charts where it's like, well, this is your stomach button, this is your heart button.
Yeah, and so with that is, it's really tough, or it has been very tough for us to really say how that is working. I mean, there's videos online that you can find where like chiropractors are asked like, how does this work? And they'll straight up just say, I don't know. And really it is because it has been like a long-term struggle for us to really research the effects of the manipulation and how it affects the brain. And that is why like I think all of us here are huge fans of Dr. Heidi Havoc because she is really like pushing like that research through, which we don't really have a lot of that specifically.
Yeah, and we have to remember this what I'm about to say may be one of the more difficult things for people who want to come to chiropractic school to swallow. When someone comes into your office with cancer, you're not treating the cancer.
No.
When someone comes in and they have stomach problems, you're not treating the stomach problems. The connection between chiropractic and the rest of the human body is how does spinal dysfunction affect your overall health? That could be from an inflammatory standpoint, a neurological mediation standpoint. It could be brain activity. It could be a neurological impingement. There are so many ways in which how adjusting the spine and adjusting all segments of the spine can affect the health of the rest of the body. So just going off of everything that you were saying right there is the struggle in chiropractic is to figure out the connection between spinal dysfunction and all these other ailments that humans have to deal with and that the medical community is trying to take care of. But again, we specialize in the spine, we specialize in the nervous system in terms of how we learn about it. And sometimes when you adjust certain segments, you get connected anatomical changes from what you adjust. But again, it's figuring out the connection between that. But no, chiropractic, you're not coming in, there's not anything that I'm going to adjust that's going to take away your cancer. Now, can adjusting someone potentially help some of the side effects of someone that has cancer or help some of the underlying mechanisms that's allowing that cancer to persist? Question mark, we'll leave that for another episode. That may be a little dicey for the first episode, so we want to make sure that people are coming back and visiting us again.
But yeah, so like, I mean, basically everything we just kind of said. Another great book, a good read I'd recommend is The Reality Check by Dr. Heidi Havoc.
And we're definitely going to be doing like a book review episode on
yeah.
this. So there's so much that we can talk about.
I want to say, the subtitle to The Reality Check is A Quest to Understand Chiropractic from the Inside Out. Mm-hmm. Now, I'm pretty sure the overall theme about it is, it's like highlighting spinal dysfunction and how it sends altered afferent, or for those of you that don't know, afferent, more like sensory signals that adjust brain output and body function. So that kind of goes along a lot with what you were just describing. I know we mentioned The Social Transformation of American Medicine earlier. Another great read, The Reality Check by Dr. Heidi Havoc.
Mm-hmm.
One of the things that I also want to get into before we get out, we're running about an hour now and it's going great, so I'm really happy with all this.
Hopefully we
I
don't
want to
have to cut
go
anything
over. I want to talk about. So we talked about the scope of practice. We talked about just the kind of curriculum that you have when you come to chiropractic school. I want to talk about the kinds of people that teach us. I think sometimes people think that there's no connection between medicine and the research world and chiropractic. A lot of our professors that come here are medical doctors. They're medical doctors. They've been medical doctors all over the world. Some of them hold dual doctorates in either as like an MD and a PhD or an MD and a DC. We actually have one professor as well. She's a veterinary medical doctor as well as a chiropractor. So we want to just take a second and highlight some of our professors just so you know the kind of quality education and the kind of work that they've done. So if I go down here, first off, and again, this podcast isn't associated with Palmer College of Chiropractic. We are bringing up some of our professors just so you can see the kind of merit that comes to the school in both the medical profession and the chiropractic profession. So our first doctor, or our pathology professor, so Dr. Alattar taught us NMS as well as systems pathology. He's taught different things throughout his time at Palmer, but Dr. Alattar started as a orthopedic surgeon in Egypt, and when he was serving for the Egyptian military, doctors from the International Chiropractic Association at the time came over from America to do a study. He was tasked with finding people in the hospital that would fit the qualifications for this study. The study at the time was just done on low back pain. So he went to the hospital, they found a bunch of people with low back pain, and he selected them for the experimental trial. At the end of the trial, I think it was like a 4-week study, maybe it was a little bit longer than that, 6 weeks, 8 weeks. But not only did a lot of these patients recover from the back pain that they were dealing with, but they recovered from some of the other things that were not related to back pain that they were dealing with. Dr. Alattar thought that was fantastic. He was so intrigued by it, so he came to America to work for Dr. Sid Williams. But he's an MD, MS, DC, and an FICA. He was responsible for, I think, the advancement of the pathology program at Life College of Chiropractic. And he was also responsible for, I think, helping to bring chiropractic to 12 different countries.
Yeah, I believe if you scroll down on here, it actually describes.
Yeah, so for over a decade, Dr. Alattar played a strong role in introducing chiropractic to several countries through his work as Dean of International Programs at Life University and an Executive Director of Life Foundation Incorporated, a 501c3 IRS-approved nonprofit organization from 1991 to 2002. Dr. Alattar lectured about chiropractic, attended international conferences, scientific seminars, and special meetings with top officials to promote chiropractic in the following countries: Argentina, Brazil, Peru, Costa Rica, and I could go on. He even worked with the Olympic team at Costa Rica, and his merit is that they all won medals, so chiropractic helped the Costa Rican national team win medals, so that was pretty fantastic. Dr. Alattar is awesome, but that's just one of the examples of the kind of people that you'll get an opportunity to work under. Our next is going to be Dr. Herr. Dr. Herr is a class favorite. He teaches spinal anatomy.
Gotta love that guy.
Also taught some of the regular anatomy classes, or gross anatomy classes as well, in the lab and in the lecture room. One of the cool things about Dr. Herr is he was an orthopedic surgeon from China. He did a lot of work with orthopedic surgery on pediatrics, and he's also an avid researcher. So him and his wife, Dr. Zhang, both came to Palmer, I think about 20 years ago, and they've been working on research throughout their time here to test how the different educational models can affect chiropractic, as well as doing actual chiropractic studies. So he has 19 publications here on ResearchGate. It's been read by over 25,000 people, cited 788 times, right?
2,500.
Yep.
What did I say, 25,000?
Yeah.
2,500, 2,506. Do you guys have anything to add to Dr. Herr?
I mean, not necessarily Dr. Herr, but Dr. Alattar. Like when we brought up names like Dee Palmer, Henry Gillet, Leonard Fay on an international level. Dr. Alattar has had just as big of an influence on what chiropractic is.
Yeah, I mean, you saw right there, we thought it was like around 12, but he had a hand in chiropractic in 29 different countries. That is an incredible number.
And this is important to note because people think that all MDs hate us, but that's not true, right? Like if you look at a lot of our professors and a lot of the people MDs around the world, a lot of them work with us to push the career, and then we have a guy like Dr. Alattar who's an MD and a DC, and it shows not just the merit and the validity behind our profession, but also our ability to work alongside other healthcare professions to further what we know about healthcare as a whole.
And one of the other things that we'll talk about too, once we get to Dr. LaRose, I guess we can go right into Dr. LaRose. I don't have anything. I just have a blog that he had posted, so I'll just go back to Dr. Alattar's thing here. So Dr. LaRose, he is an MD, and he never necessarily got his DC, but he was the dean of a medical school over in Africa. I think he worked as an instructor in the medical community in Hawaii. I think it said like West. I think it was described as like West Indies, and then in Africa as well. So we have doctors that have taught pathology, taught immunology, and a million other things at these medical schools, and then they come to our chiropractic school. They come here to Palmer, and they teach the same topics in a very similar manner to make sure that we are understanding the kind of information that they made their medical school students understand, right? So just because a doctor comes over doesn't mean they necessarily have. We said you want to learn life sciences from a chiropractic perspective, but when it comes to understanding disease, you just understand disease, right? Like pathology is pathology, system pathology is system pathology. And we have professors who have worked in war zones, worked through things like, the AIDS epidemic in Africa, things like Ebola. They have seen some of the worst that disease has had to offer. They take that experience and then they bring it over to America and they teach at our chiropractic schools, which is pretty fantastic. And I just don't think it's something that a lot of people understand.
Yeah, and to go back to what you were saying about Dr. LaRose, he has his MD, and then in Africa, you don't necessarily get a doctor of chiropractic, you get a master's in it.
Yes.
So it's more of a master's program. So he does have his master's in chiropractic.
Okay, cool. Know that. Cool.
And he told us the story about how he discovered chiropractic, and he had a patient coming in, was having
thought it was a peptic ulcer.
Yeah,
some sort of GI.
And it was right after the one guy, the researcher, had won the Nobel Prize for discovering H. pylori, which causes peptic ulcers. So it was right at the time, and everyone's giving out what's the medication for it?
Famotidine, Xanthol.
Anything.
Yeah. PPIs and acids.
Yeah.
Yeah, but and he came in with this pain, and he couldn't figure out how to fix him. He kept saying that he kept ignoring him, and
it was like 5. I think that they think the person came in on 5 separate
say
occasions.
nothing's really wrong with him. He's fine. And then I think that's how he described it. Is another doc came in, basically
one of his mentors.
Yeah, was like, here, just lay down.
Yeah.
And since an adjustment, I believe that he said around T6,
yeah,
around that area, and the patient left the hospital with no pain. And he said right then and there, as an MD, I need to know how to do this. Incredible, first-hand story about how you discovered chiropractic. But a big thing I wanted to also kind of touch on, and you mentioned it, is Eastern, the Eastern Hemisphere. A lot of countries out there, they utilize chiropractic a lot more now. I'm not 100% sure on these numbers. I believe one of our professors, Dr. Afghani's, who said these numbers. I want to say around 70% of chiropractors, or 70% of the population of communities, utilize chiropractors in the East.
Yep.
Whereas in the West, specifically America, Canada, I want to say it was only 14% of the population.
Maybe less, 8%.
Yeah,
somewhere around there. We'll find the numbers for the next episode. We'll make a note about that.
Yeah, and that is something that I just would really like to see is, I think in the East, chiropractors are looked as a part of the healthcare system with MDs. So I know they work hand in hand. They work together. Specifically, a lot in Africa. Mm-hmm. I know that's a much different topic, because obviously much different scenarios in Africa, much more rural. But that is something that I think it'd be, because I know we talked a lot about MD versus chiro today. Mm-hmm. I would love to see that in the future. Just being able to work hand in hand with each other, like they do in the East. But I just know that you had kind of talked about how they were doing that, where Dr. LaRose was, and our boy Dr. Alattar. So I wanted to bring that up as well.
And I think we are shifting in that direction, right?
Yeah.
I think here in the U.S., a lot more MDs, PTs, DOs are starting to work with chiropractors instead of against. Obviously, none of us have been in practice yet, but from secondhand comments that doctors that I'm close with, friends that I have that are in practice, it seems like the medical profession is starting to catch up and then welcome us into the healthcare department.
Yeah.
Yeah, I think you see more chiropractors nowadays working in the interdisciplinary practices, and I personally worked in I had a job in an office kind of as an assistant prior to coming to Palmer, where on one side of the hall you had a DC and a physical therapist, and on the other side of the hall they had a medical doctor practicing.
Okay.
And so, kind of going along with what you said, you do see real life examples of that nowadays, and I've heard stories of chiropractors being in hospitals, and and they're great because it creates a great referral network back and forth. And we hear chiropractors practicing in hospitals now. So there's definitely a different relationship than there was 100 years ago.
And we were never trying to take their jobs, right?
Absolutely.
Like our job is not to replace MDs.
Yeah.
Our job is this is what we're good at. Chiropractors, what we're good at, looking at healthcare from our lens.
Yeah.
And then they do what they do, right? Like we need to work together.
Yeah, a big kind of point in like African regions is chiros and physiotherapists, those kind of professions are like really needed because so many people, there's a lot of people in Africa that obviously have a lot of health issues, and general MDs are just overrun. Like they can't handle the amount of patients that they have to see, and the big reason why they would like chiros and physiotherapists over there is because they are able to take that load off, take the kind of cases that should be an initial chiropractor or physiotherapist case, and then they can help those patients while the MDs there can focus on like obviously the lot like bigger key items, things that we can't necessarily treat. And I think it'd be great if that's how it could really shift to. But our guy Brett Winchester, his practice over there in, was it Troy?
Troy, yeah.
Yeah, he's got. Didn't he say he has like 2 MDs on staff?
Yes.
And his practice is amazing, man. How he has that thing built. I'm sure it runs, dude, so well.
Yeah.
And one more person to bring up, just so we don't leave her out of the mix. So Dr. Her's wife, Dr. Zhang, she was an MD. I don't know if she was like a general care practitioner for pediatrics, but she's over in the States. She's doing research as well. She taught us immunology and endocrinology, and physical diagnosis, and she was absolutely fantastic. And we all loved her. I think we all wanted her to speak at our white coat ceremony. Yeah. So that's fantastic. And then not only do we have expertise in the medical doctor field, but we also have chiropractors that have also worked in the field for over 40 years. So we have Dr. Meisel, who teaches us gross anatomy. He was a chiropractor for almost 40 years, or up until this point. So we have people who are experts in both the chiropractic field and the medical field, teaching us about the human body, and then teaching us how to take care of it, which I guess is the most important thing. Last but not least, unless you guys have anything else you guys want to add to the episode, I think we have one more thing that we wanted to discuss, but I think we can make something fun. Just real quick, one line of advice to current chiropractic students or people that are just entering the college, and then we'll get out of here.
Oh boy, I guess I'll take it off. Buy in, right? Like, don't be half in, half out. Don't double guess. Don't sit here and be like, hey, like, should I have gone to physical therapy school? Should I have gone to medical school? The profession that we are in is beautiful. And like I said earlier, it's survived off of nothing but merit. So you got to buy in. And what does that mean? That means take your time and do your own research. Like when you're in those classes, don't half-ass. Like, lock in, absorb as much knowledge as you can. And when you are at Palmer College of Chiropractic or whatever other college of chiropractic you're at, that's what you're there to do. So don't half-ass it. Don't step around it. Just buy in and love this stuff, because there's so much to love.
Awesome. Am I going? Okay. Yeah, I would say that my line of advice, especially for kids that are in chiropractic school right now, is remember your why. And I know nowadays, like, that word is thrown around kind of a lot, like, what's your why? And just when I say that, I mean what drives you and what's your purpose in doing what you do. And I think it's really important that you have to be intentional while you're in school. And the reason I say remember your why is it is so easy when you're in the middle of sitting through pathology classes and physical diagnosis, and you're going through anatomy and you're trying to learn and work at your technique at the same time. It's so easy to get down on yourself, and if a test doesn't go so well or whatnot, or you're just tired of studying, it's so easy to get down and forget because you just feel like you are a professional student and it will never end. But I think it's really important to have a goal to start out with, and I think all of us obviously do here, to have a goal and have a mission in what we're trying to do and why we want to be chiropractors, and then just utilizing whatever that is, whatever that mission is. You have to remind yourself when you're in the program and when you're going through school to remember why you're doing it. And I think for most of us, like, we really want to help people. Like, that's a general term, but we really want to serve and help people because we've all received amazing results from chiropractic, and it's changed our lives, and it's currently changing our lives. And we want to be able to provide that for other people too. But just for students, you got to remind yourself why you're here, because it is really easy to just get caught up in the everyday, just grinding. And so, that would be my advice.
Awesome. Okay, me?
I'm about to drop a bar on you guys. Okay?
All right, let it rip.
You typed it up.
So this is, part of this is something that, early on I was not doing, but I would say my advice to you is master the science, honor the art, and never forget that every adjustment touches both the spine and the soul.
Where'd you get that from? You didn't come up with
That
that.
was philosophical.
Hey,
I like it.
off the
Fantastic.
nog, off the nog.
Well,
Off the dome.
that's a really hard one to follow. But I just want everyone to know, anyone that's either considering coming to chiropractic or in chiropractic school, is you have been given a monumental blessing to wake up every single day, learn from some of the best in the world, to be able to study the human body in the labs, and have access to a library and access to people who want the same thing as you. So don't take any day lightly. Keep showing up no matter how tough it gets. Show up, learn as much as you can, because you're going to have the power to change somebody's life. So not a single thing that you learn is going to be too big or too small to be able to apply it to someone who's really struggling, right? So if you want to help people with their mental health and their physical health, take every day seriously, wake up with a purpose, because you are good enough to make a difference in somebody's life.
Absolutely.
So, everybody, this has been an awesome first episode of The Adjusted Perspective. If you have any questions, if you want us to talk about anything, please reach out. We are going to be on Instagram, YouTube, and TikTok at The Adjusted Perspective, The Adjusted Perspective. We're going to be coming out with new podcast episodes, hopefully weekly, but then stay tuned for other kind of videos. We're going to be doing anatomy videos, instructional videos, teaching you how to palpate. We're going to do setups. We're going to teach you how to analyze. So if you're struggling, reach out. If you have questions, reach out. If you want to come on the podcast, also reach out to us. But other than that, this has been Gabe, CJ, Carson, and Eddie with The Adjusted Perspective. The pilot episode is done. We will see you guys next week.
Thank you.
Woo!
That was awesome.